Lord, take my hand and receive my heart. Now I'm returning home. Lord, take my hand and receive my heart. Now I'm returning home. I've wandered far away.
With the displacement came the breakdown of all infrastructures that were supposed to render services to the people. There are no schools, there are no health centers, the hospitals are not there, there are no roads, the water points are all broken. So we have done very well in some areas, but the area where we still have a major problem is the area of health. Area of health and education. But health, because the mothers and children are returning to areas which are now bushes. What was once their homes are now bushes. And they are getting infected on a daily basis by mosquitoes that carry malaria. So we are having That's why the community of Omutoi requested me that I could lobby for anybody of goodwill to help them plant a hospital in this area, so that the target would be first put a maternity unit there which can take care of mothers, and also put a pediatric unit which can take care of children. Those are the kind of challenges that we are facing. My humble request on behalf of Aruda, the organization that I am managing, is that I urgently need a maternity unit. I urgently need a pediatric unit and implements that can help to run. So it will take care of the mothers, it will also take care of the children. Malaria kills very fast, particularly children. Malaria targets the red blood cells of infants and it removes the capacity of an infant to feed. So there is no appetite, and yet the red blood cells which are supposed to provide defense are being targeted. So you find in a question of 2-3 days, a child who has caught malaria gets anemic, and the best way to restore that child's health is by putting this child into intravenous treatment, in what we call in Uganda here drip. Now that drip can only be managed in an established health facility. If you are going to do it crudely, you lose that child. You know, if a child cannot eat and yet is deteriorating because of malaria, give such a child 6 days, 7 days, the child will be dead. Infant mortality in my country is very high, majorly because of malaria. And areas where there are established health facilities, the infant mortality has gone down tremendously. But
take my hand and receive